Hi, my name is Bella Lambertz. I'm a third-year student at the University of Minnesota Rochester, and the title of this presentation is Addressing Mistreatment in Minnesota Assisted Living and Nursing Homes. And the reason why I decided to do my public health presentation on this is because I have personal experience working in an assisted living home in Minnesota, and I saw much of what this presentation talks about personally, and I feel personally about this public health issue. So for some background before I get into my content, the terms nursing home and assisted living are often used synonymously, although there is a difference in that nursing homes have a stronger focus on medical care, and nursing home and assisted living fall under this larger umbrella term of long-term care, or CCRC, continuing care retirement communities. And for the sake of this presentation, I'm using nursing home and assisted living synonymously, as that's what most of the research that I've decided to use has done as well. And then physical, emotional, financial, sexual, and neglect all fall under this term of mistreatment when I use it in this presentation. So this is an issue itself, and this is an issue all over the world, but I'm focusing on Minnesota in particular so we can get a more personal visual as to how this is affecting communities near us. And according to the Nursing Home Abuse Center, up to 85% of older adults living in nursing homes suffer from malnutrition. Research also shows that people suffering abuse or neglect were more likely to be old and non-white and to have greater limitations in physical and cognitive functioning. This issue not only affects the residents themselves, but it also affects the staff as well as their families. And I saw this firsthand during COVID, as family members weren't allowed to come visit their residents or their loved ones. So much of that emotional piece fell onto staff, which was not part of the job description, of course, and which also led to understaffing. And according to the Nursing Home Abuse Center, again, understaffing leads to inadequate attention from staff, meaning residents are more likely to get hurt through falls, dehydration, malnutrition, or bed sores. Staff on duty will feel overwhelmed and underpaid, which can make them more likely to enact abuse. And this is an issue because older adults are more vulnerable to mistreatment and neglect because most of the population suffers from diseases that lead to changes in physical and mental functioning, whether it be Alzheimer's or dementia or even hearing loss. And this can lead to a need for dependence on others, mostly that dependence being on the staff or the people working in the facilities. And this has been an issue for decades now, but this was especially amplified after the effects of COVID-19. As I mentioned, residents weren't allowed to have visitors, their family members could not come around, which led to a decrease in advocacy for these people in these assisted living homes and nursing homes. This could be due to understaffing, poor management, or inadequate training. Maybe it's due to a lack of accountability or even a lack of general passion or care for older adults. This could also be due to miscommunication between staff or families. Maybe one nurse asks if Steve had his meal for the day. Maybe the other nurse was not sure, and that led to Steve missing a meal for the day. And that stuff like this could build up and lead to the overall mistreatment or neglect of these older adults. And then to talk about the environmental justice framework, as I said, the environment piece, this occurs all over the world, but I'm focusing on communities in Minnesota. Those communities being the St. Louis Park, the estates of St. Louis Park and Charterhouse Mayo Clinic. And then the demography, as I mentioned, is older adults, particularly older adults of color, and those with dementia or Alzheimer's or other mental or physical disabilities. And again, I'm focusing on Minnesota communities. And for the epidemiology, this has led to an increased rates of morbidity and mortality, as well as malnutrition and dehydration, a decrease in kidney function, and research also shows that it's linked to increases in neurological, endocrine, and heart diseases. And for the procedures piece, the Minnesota Board on Aging funds programs that provide better nutrition, helps older adults better manage their chronic conditions, and reduce falls. The Older Americans Act is also an important one. This was reauthorized in 2020, and the OAA works to support programs that mostly help with the nutrition of older adults, and supports things such as bringing meals to the homes of older adults, or it fosters community within the older adult community. Yeah. And to talk about these two examples listed here, the Estates of St. Louis Park was cited over 50 times and was to pay over $1 million for neglect cases. This is an example of a lag indicator, of course, as this is money that, has been given to families or whoever it was that this issue was affecting as a result after the issue itself. And then, as well as the case at the Charterhouse Mayo Clinic, when a nurse failed to check the overnight vitals of a resident who was declining, which ultimately led to the death of that resident. And then the OAA, particularly it targets those with greater needs, such as the low-income and minority older adults, which we discussed this public health issue is affecting the most. And some solutions and conclusions would be better screening, whether it be nutritional and mental health, always staying proactive, communicating with staff and doctors, being that advocate that resident needs. The big one here being more funding allocated to these facilities, whether it be via the MBA, the OAA, and increased pay, better training, and advocacy. Thank you.